Is that part of what you find so interesting about your specialty?
You know, the skin, it amazes you every day because this, certain conditions can look different on everyone. And then when you're the dermatologist who picks up on something rare or something different and you can actually find something inside the body that might be harming the patient, you actually feel pretty good about that. So yes, that's a part of dermatology I really like. It's actually a really good window to general medicine.
How interesting. Have you ever had a case that's stumped other specialists and you've said, well, this appears to be this because of this sort of presentation on the skin?
You know, actually I do remember a case. It was a couple years ago. There was a gentleman who came in and he was consistently diagnosed with eczema over and over and over and over again. And sometimes if you just look at something really quickly, you might dismiss it as it being pretty simple. But we did a complete exam on the patient, and what we found out is he had a condition called mycosis fungoides, which the other name is cutaneous T-cell lymphoma. And a lot of times, it's not a particularly dangerous condition. Oftentimes, the condition outlives you, but it can progress where it can harm you.
Lymphoma sounds scary.
It does. It does. But you know what? When you catch it early and you watch it, you monitor it, you can actually do fairly well with it. With this particular type, it's a very skin-specific type. And so when we, you know, suspected that and biopsied that and found out that that's what he had, we felt pretty good that we caught on to something that was very specialized to our field that other people had just dismissed as something simple.
My father passed away from leukemia, but one of his first symptoms was sort of a reddish bruising on the arms. Is that something that's common in leukemia patients?
It is. Actually, leukemia patients, they can have other, I want to say, blood abnormalities where they have low platelets and they can bruise like that. There's also a leukemia localized to the skin. Well, you have the blood leukemia, but you can have skin findings is what I mean. So there's a condition called leukemia cutis where you can actually get these purple bumps that present on the skin. And if that's a presenting complaint for a patient and you biopsy it and you do find that, then you can warrant further investigation that can lead to a diagnosis of leukemia and save your patient.
So I think of dermatology as something mostly where people present with problems that are treatable, and usually they are successfully treated and they go away, and you don't usually have to do too much delivering of really bad news, or gee, other than I suppose skin cancer. I think of melanoma as being a potentially fatal, but there are other cases that you might be dealing with where you might be telling somebody, look, you've got cancer. It's not skin cancer, but it is something that's very dangerous and we've got to deal with it right away.
Well, in dermatology, actually, it's a happy specialty. Dermatologists themselves are happy and their patients are generally happy. And you're right, a lot of what we do are chronic conditions that aren't particularly dangerous, but there are also a lot of serious conditions. Those being the cancers that you mentioned. There's also a lot of connective tissue disease, illnesses that can cause a lot of morbidity. So patients may not have their health seriously at risk for death, but they are seriously impaired every single day. So dermatology, while it's especially where your patients aren't necessarily acutely ill or in immediate threat of dying most of the time, they do have conditions that severely impact their quality of life. And as a dermatologist, if you can make that better, you feel really good about yourself and your specialty.
What conditions might you treat? And we're going to be talking further in the show about psoriasis and eczema and many of the other, and certainly skin cancer, several of the things that you've mentioned so far. But when we return, I want to ask you what disorders you might be treating that have a genetic component. And everybody, of course, wants to know about how to deal with acne. It's no longer just the bane of teenagers. A lot of us have acne right up until the wrinkles arrive. So stay with us here on HEALTHline. Dr. Don Mehrabi, dermatologist and guest this evening. We've just begun to explore the topic of the skin. We're back on HEALTHline with Dr. Don Mehrabi, a dermatologist with a practice here in Glendale at the medical center that's right next to Glendale Adventist. And also he has offices in Tarzana and in Beverly Hills. And in our previous segment, we were just getting to the topic of skin disorders that might have a genetic link and why some families seem to have more cases of acne than others. Doctor?
Well, for the longest time, we didn't think that acne had any genetic component. But the more recent thought is that acne actually does run in families. We don't have a gene. We don't have something that we can pinpoint and tell you your likelihood of getting acne if, say, your sister had it, or your mother had it, or your father had it. But what we have seen is a trend. So if acne has run in families, you do have a pretty good likelihood of having acne. Although I can't tell you which gene it lives on. It's very likely that, you will get it.
Is it something to do with maybe overactive oil glands?
Well, the pathogenesis of acne, the way the acne is formed, is that there are several components to how it's formed. The main way that it's formed is that oil builds up in the pore gets blocked, the oil tends to build up even more, and then bacteria sneak in behind the blockage and cause inflammation. So that's the way acne is formed. The reasons why acne builds up are a couple reasons. The main reason being hormones. The hormones cause the oil glands to produce a lot of oil or sebum that can easily get blocked up. Number two would be makeup. Makeup is a physical blocker, so it gets in the pores, causes the blockage, and then causes the oil to back up behind it. And then other things such as stress. Stress can have an influence on oil production, and then also things like physical touching your face or rubbing something on your face, that can also cause pore blockage. So the pore blockage plus the oil buildup with some hormonal or genetic factors pushing that along cause acne.
And what can we do to prevent it, starting at an age? I think, for example, my two little girls, the one who just turned 11 is starting to get a little pimple here and there, and I try not to call attention to it, but I do remind her that washing her face morning and night is a good first step, and not with harsh soaps, but with a facial cleanser. What do you suggest to your young teen patients? And let's move up the age scale from there.
Well, it sounds like your daughter's around 11, as you said, so as soon as she really gets into puberty, her hormones will start taking charge of her acne formation. So you're going to probably see a little bit of a progression in her acne. As far as preventing acne, well, you're not going to do anything for the hormones at that young of an age. So proper skincare, like you mentioned, is a good way to go. And doing a gentle cleanser without a fragrance is a good first step. And one of the ones I usually recommend is Cetaphil. There's also CeraVe. They both have hydrating cleansers that are excellent for removing dirt off the skin.
Can you spell those, Cetaphil?
Cetaphil is C-E-T-A-P-H-I-L, and CeraVe is C-E-R-A-V-E.
Okay.
They don't have fragrance, so they're less likely to irritate the skin, very well tolerated. Doing that twice a day would work very well in cleaning the skin. A second thing is to not use makeup, not touch the face, so you don't get any of the physical blockage that we just mentioned. And a third thing is, if you do get a pimple, a lot of people want to squeeze them or pop them. While that might be fine for some people, for others it leads to scarring, excess inflammation. It can also, some people are worried about it spreading. That's not so much the case, but the touching and the rubbing associated with trying to pop a pimple might cause inflammation in other areas and cause blockages that might cause acne. And then as far as doing things over the counter, doing a salicylic acid wash, such as Neutrogena.
Salicylic, that's with an S.
That's with an S. Yeah, just like a Neutrogena face wash, they have 2% salicylic acid in it, and then there's also Clearasil and Oxy with those products with benzoyl peroxide in there that are also very effective in preventing acne.